Hey guys, Amy Wood here. I'm joined tonight by Dr. Cedrek McFadden. He is our 7 News expert. I mean, he gives us all the information on the health topics of the day. He joins us on Carolina's Family at 4 normally, but we're pulling him in to the news cycle because there is a big medical story that a lot of us are following, a lot of us have questions about. And so we went online earlier today to ask you guys for your questions, and you're free to post some more right here, right now. But we did pull together viewer questions to kind of take to Dr. McFadden and to, as I call you, Dr. C, to get the very latest information. But first of all, thank you for taking the time and joining us tonight. 8 o'clock is a time where a lot of people are home and able to watch.
Yeah, well, thank you for doing this. I think that a lot of folks in the community will appreciate it.
I do too. All right, let's talk a little bit about some of the questions. Let's begin with this one from Linda Ward. Okay, she's asking, here's a question: can people carry the virus and spread it without ever having a symptom? What do we know about that?
Yes, so most of the cases that are seen and diagnosed are present in folks that caught it from someone with symptoms. But just like many other viral infections, you could actually still transfer without having symptoms.
So that's why we need to wash our hands, right?
That's why we need to go back to the basics of washing your hands, taking the time, the 20 seconds to wash your hands very thoroughly, and also making sure that you're avoiding touching your face, which is very hard to do. I mean, I started this video and I was doing this, and we constantly touch our faces. So making sure you're not touching your face, because that's one way in which the virus is transferred to us, by just touching of the face, sneezing into, you know, the palm of your elbow or tissue as opposed to your hands. That can be another way that you can reduce or prevent respiratory illnesses such as the coronavirus. And this is true for many other respiratory viral infections, not just the coronavirus.
Absolutely. When it comes to the symptoms, I know I had a question here. I'm trying to find it, but one of our folks asked, you know, what are the symptoms? I guess might have been Tiffany Sams, but what are the symptoms that people should be paying attention to in case they somehow unknowingly get exposed to someone who has corona?
So the symptoms are very similar to other types of viral and respiratory infections, but the 3 most common that we're talking about are fever, cough, and shortness of breath. And if you think, well, I have fever, have cough, have shortness of breath, then I must have coronavirus, that may not be actually true, because you have to put it in the context of the whole picture. If you've not traveled to one of the areas that we're most concerned about, or if you've not had first contact with someone who's traveled to one of those areas, then it may be less likely that you don't have coronavirus, and you could have influenza or one of the other common viral respiratory infections.
Debbie Crimes is asking, can you only have it once? Is it possible to get it twice? Do we even know that yet?
So that I don't think we know the answer to. Again, this is a novel or new type of coronavirus.
Right.
I mean, coronaviruses have been around for some time, but this is a new type of coronavirus. And so therefore, we don't have that particular information.
And when you hear people talking about it's just like the flu, is it? I mean, what do we know about the differences? Somebody, I think, also asked us, you know, what are the differences between the traditional flu we experience every winter and this new illness?
Well, part of the challenge is we know a lot about the traditional flu because we've had years to have practice with it. So we know when the season starts, we know when the season ends, we know kind of how people generally respond. We know that this year alone, probably 12,000 people will die of the flu alone. This year with this particular coronavirus, right now we have, 3,000 deaths so far.
And let's talk about the situation in South Carolina to reassure folks that we do have one coronavirus case that has been announced in North Carolina in Wake County out of our viewing area. And then we have, I think they did like about 50 tests on various people with various symptoms in South Carolina. Most of those have been cleared. They do have 13 people that they are monitoring right now. No positive tests in South Carolina at the moment. And that's important to kind of share with people, right? Because the concern, we just are hearing tonight about Maryland having their first cases, Colorado having their first cases. As much as we all travel, is it pretty much inevitable that most states are going to see a little of this?
Well, we live in a global society right now. We travel and we do a lot of that. And so it is perhaps likely going to increase the numbers. But again, most of the cases that we see are mild. 80% of those that we see don't have any need for ventilators or any aggressive medical treatments.
We have a viewer, Donna Lister, who says, I have multiple sclerosis. She says, my parents are in their late 70s and have health issues. Do we need to be concerned? And there are certain populations that need to pay particular attention and do the most that they can to avoid this problem, right?
Correct. So people that are at higher risk include people that have chronic diseases such as diabetes, people who have immunosuppressed states such as cancers, chemotherapy. Those are people, older people, that we're going to be more concerned about, that are going to be perhaps higher at risk.
In terms of what you do to prevent this, we have a viewer here on one of our pages here, Helen Carter Martin, who said, hey, please show people the proper way to wash your hands with soap and water, because we've talked a lot about this, and people hear the sing happy birthday for 20 seconds, and you being a surgeon, I always think about like the movies, and when I watch surgeons washing their hands, you guys do it so thoroughly, right? I mean, that's kind of what we're supposed to do.
We do. I mean, again, so we wash our hands for more than 20 seconds.
Sure.
But, in this case, what we really want people to focus on, not so much on the back and the front of their hands, but the fingertips.
In between and
really in between the nails, you're really taking the time to get on both hands and really taking advantage of that time just to pause, to wash hands. And most of us don't really do a good job of that. We rush through it, just kind of get through it, but really taking the time to do it properly.
A lot of people are asking, you talked about how we know the flu, we know the traditional season of the flu, for example, but with this virus, what do we know about when the weather gets warmer? Do we expect it kind of to do like the flu and perhaps ease off?
That's a question we do not have the answer to. I mean, this is the first year of dealing with this. I mean, other coronaviruses behave sometimes like our normal influenza, but we're not certain of what this particular one will do.
Trishanda Ruckard is asking, can you catch it without being in direct contact with someone who has it? Is there another way to get it?
So right now it is believed, and it's likely, that the mode of transmission is through respiratory droplets. So that's from, someone sneezing, someone coughing, spitting, or, talking really closely, and then it landing, and then it being taken into close proximity to your nose, mouth, or ears. If it's not through close proximity like that, perhaps it can be on a surface. You've coughed, you sneezed, you opened the door without washing your hands, then you touch the door without washing your hands, don't wash your hands again, you touch your face, and now it's transmitted. So that's the most common, and that's what's likely to believe what's going on here.
And I had read an article from a medical person that said one of the most important things we can all try to work on now, especially before we have cases in South Carolina, is not touching our faces, which sounds easy, but we unconsciously do this more than we realize.
I almost just did now. It is a constant thing that we rest and we do that, but it's one of those things that can transmit not just coronavirus, but any viral respiratory illness. And might I add that this is not this epidemic this coronavirus outbreak. This is not something in our response to it that we're not trained to deal with. I mean, we've had years to prepare for these types of plans. We've done it before with bioterrorism. We've done it with SARS. We've done it with smallpox. We're very well prepared. This is what health professionals are trained to do. And so we're tweaking some of those plans, but this is our world.
All right, here's a question from Tracy Bobo Garner, and she wants to know, can you just have the cough, shortness of breath, runny nose, and no fever?
So most of the cases studied so far have had fever as perhaps the presenting symptom, cough with perhaps shortness of breath. And I guess there's varying degrees on, if someone presented on admission with just fever, then they develop the cough, then they develop the shortness of breath. There can be a combination of kind of when those occur, but those are the three symptoms that we're referring to now.
Somebody asked, Shirley Lay asked, can you get coronavirus from handling money, which is a very specific ask here, but in general, touching surfaces, I mean, that might have someone else's droplets on it, which I guess could be money. Those could be places where you could encounter the virus.
Yeah, I guess the main question becomes, how long can the virus live on surfaces? And
Right.
does it depend on how porous the substance is or how solid the surface is? Could that be from hours to days? What's the temperature of that surface? There are other factors that
So
go
many
into
factors.
That's when we get back down to it. It's all in, what you can do: wash your hands, pay attention. If you're sick, stay home, paying attention to those types of issues.
A lot of people, of course, spring breaks are coming up. Summer travel is coming up. There's so many people the wheels are turning to make plans, reservations, book flights, all that stuff if you're in that position to do that kind of thing. And Lori Hill says, for example, she's got a cruise planned to Cozumel in June. Should I cancel it? I mean, a lot of people are wondering what to do. I mean, what is the best advice at this point? I know that the U.S. has given very specific country instructions. There are 4 countries involved. You can see those on our website, and on the CDC website, they have constant updates on the travel recommendations from the government. But in terms of overall, what's one to do right now? What is the best guess on that?
So if you're traveling to a country, I would definitely say consult the DHEC website, consult some of the resources online to make sure that you're traveling to a place that is approved. I mean, the ones that we currently have some restrictions against: China, Iran, Italy, South Korea, and Japan. But there may be others as time goes on that you may need to refer back to. You also want to talk with your travel companies or your airlines to see what their restrictions are about changing any trips that you may have planned, so that you're making the best informed decisions as you're making the trip plans.
Some of the people are asking, when we know that it's coming from other places and moving into the places that does not have it already, why are we allowing the flights to keep going? Those are more political and governmental and health organizational questions than for you and me to answer. But this is something that, like you say, we do live in a global society. It's almost impossible to stop it completely, right? I mean, there's going to be some transmission and some crossover and movement of this illness.
But we can limit.
Right.
If we focus on the things that we can do,
right,
we can greatly limit. If we can keep people who are sick at home, not in the community, that can go a long ways to reducing the spread.
And I know you had put up, you have a screen there that has some of the latest numbers from the CDC website and such. You want to give us sort of a little sense of where we're at with this right now?
Yes. So right now there's 98,000 current coronavirus cases and 3.3 thousand deaths. Now, what you have to keep in mind that out of those cases, 54,000 of those have recovered. And out of the folks that had active cases, 84% of those were mild. That means they perhaps had fever, they perhaps had cough, shortness of breath, that didn't require any intensive or critical care from a hospital. So, we want to keep it in perspective of kind of what most people will encounter if indeed that we can just sort of slow the brakes on the panic. Because you can imagine, as we report each individual death in each location or each individual case, it does raise the alarm. But we just put in perspective kind of how we stand to treat and how this raises in proximity to how we normally treat influenza viruses and things like that.
As a doctor in the community, obviously, you have friends and patients and colleagues. I mean, is this a major point of discussion? I mean, I don't get the sense from looking online at people's questions and from talking to viewers that I run into that there is panic per se. I feel like people are just curious and they definitely want to have the best information.
Well, there's a lot of attention being paid to this. If you look across social media, across the news sources, there's a lot of attention. Perhaps it's the first or second story reported on most of the evening news stations.
Yeah.
And so that does raise people alarm for it. But again, if you go into the hospitals, this is what people who work in hospitals are trained to do. We're trained to deal. We've had years to practice on other situations, and so this is in our wheelhouse.
In terms of one other question, Donna Wheatley asking this one, and I've had this one come up from viewers before. Can the animals that we have, can our pets get the virus? What do we know about that?
So this is one of those viruses that can live. Coronaviruses can live in humans. It can also live in animals. We're not sure exactly right now if we can now have a person to an animal transfer. That's certainly not something that I can answer right now on that question.
Gotcha. Well, guys, you are watching a live Q&A with Dr. Cedrek McFadden. He's our medical expert here at 7 News. I'm Amy Wood. This is Dr. McFadden on the screen with me. And we're just kind of taking your questions this evening, letting you know kind of the latest information we're getting, both through, obviously, the doctor's medical knowledge and the information he's able to obtain through his connections and his own hospital system and everything else in terms of the data that's out there and the information that's starting to come into the medical community. And of course, we asked you guys to leave your questions with us. This is going to be the first of, I'm sure, a number of these that we will do over time. So if you have more questions that we haven't answered right now, please leave comments. If you're watching this after we're live, we will try to get back to you with more. And we'll probably do another one of these next week as we continue to follow the developments. But to remind everyone, if you're just joining us, there are no confirmed cases in South Carolina. There's one coronavirus case in Wake County, North Carolina so far. There are 13 people being monitored in the state of South Carolina, but again, no positive testing here yet. So that's good news at the moment. And we just want to kind of give you the chance to have your questions answered. So make sure if you need to ask anything, put them in the comments below us. And I want to thank you, Dr. McFadden, for joining us tonight.
Thank you for having me.
All right, and stay with 7 News. We'll keep you up to date. We do have a very special, I'm going to pull you out of here, Dr. McFadden. Thank you so much for being with us.
Thank you.
I do want to point out to you guys that we have a very special section on our website. It is the coronavirus section. So I want you to make sure you take a look at that. On there, we talked about the washing of hands and doing a really good job washing your hands. There are 13 or more songs, 31 songs, I can't remember, but there's a list of songs on our website that'll show you songs you can sing to yourself to make sure you hit the 20-second mark. And if you don't like Happy Birthday, there's some options for you there. There's also a lot of other information about the various health departments we're hearing from. We've had various hospital systems speak to us and release information. And of course, the Department of Health and Environmental Control today spoke to state lawmakers. They had a sort of Q&A with the state lawmakers, including the specialist in the state who watches viruses and really keeps on top of that, and the director of DHEC as well. So check that out. All those pieces of information are there if you ever need that information. And again, keep the questions coming. We will definitely feed those back to Dr. McFadden and get back to him, our 7 News medical expert here on 7 News. Thanks for listening and watching. I'm actually off tomorrow to do some fun things with my daughter. She's in a play. So if you want to see Tarzan, go to Converse College this weekend and I'll see you there. But otherwise, I'll see you on the news next week. Thanks for watching and listening and trusting 7 News to be your source on this very important story. Have a good night.